Diagnosis of sugar disease. If signs of the disease are noticed, it is of course necessary to determine whether or not sugar disease is present. To do this, several laboratory and instrumental examinations must be carried out. Determination of blood glucose levels. After 8 hours of starvation, the amount of glucose in the blood plasma in the hungry state is checked. Glucose sensitivity test. In a hungry state and 2 hours after eating, blood glucose levels are compared among themselves. Glycemic tracking. Multiple analysis of blood sugar levels during the day. Applied to study the effect of treatment. The presence of glucose, protein, white blood cells in the urine is checked. The presence of acetone in the urine is checked. The amount of glycolyzed hemoglobin in the blood is determined. Biochemical analysis of blood. All patients with diabetes are required to be examined by the following specialists: endocrinologist, cardiologist, neurologist, ophthalmologist, surgeon. Diabetes treatment. In type 1 diabetes, the body cannot independently produce insulin on its own. Therefore, it will be necessary to take insulin to help control blood sugar. Insulin is the main treatment for type 1 diabetes. The introduced insulin replaces the hormone that the body cannot produce. Other additional treatments, as well as proper nutrition based on the diet, performing the prescribed physical exercises, will benefit in controlling the symptoms of type 1 diabetes. There are 4 most commonly used types of insulin. They differ in how quickly they begin to work and how long their effect lasts. Fast-acting insulin begins to act in 15 minutes, and its effect lasts 3 to 4 hours. Short-acting insulin begins to act within 30 minutes and lasts from 6 to 8 hours. Medium-acting insulin begins to act within 1 to 2 hours, and the effect lasts from 12 to 18 hours. Long-term insulin begins to act a few hours after the injection, and the effect lasts 24 hours or more. The patient can effectively manage type 2 diabetes. To manage type 2 diabetes, the following recommendations should be followed. Include foods rich in kletchatka and healthy carbohydrates in your diet. Eating fruits, vegetables, and whole grains can help keep blood glucose levels stable. Eat only until you are full. Don't overeat. Keep your weight in moderation. Do about half an hour of aerobic exercise every day to help keep your heart healthy. Exercise can also help control blood glucose. It is also important to do the exercises correctly to control glucose. Because failure to follow the rules can be counterproductive and also cause a drastic change in blood sugar levels. Get informed through our article, Healing Exercises in Diabetes, with exercises and guidelines recommended in diabetics. Your doctor will explain how to recognize the initial symptoms of too high or too low blood sugar and what to do in each situation. They will also help you find out which foods are healthy and which are not. Not all people with type 2 diabetes need to use insulin.